that would be nation-centric. So, meaning that every nation will have to look at their cost of providing an organ, a transplant to their patients with kidney failure. So obviously, if you're in the US, that would be the most expensive. Singapore would rank fairly expensive in terms of organ transplantation and kidney transplantation. India, of course, maybe would be much cheaper than Singapore. But I think your main stumbling block is not just cost. The main stumbling block is the availability of donors, whether they're living donors or deceased donors. And I think India is doing a good job. India is progressing. Not rapidly enough, but at least progressing in terms of developing a deceased donor program.
Also the data analytics, how come it how much it is integrated into the Indian market or Asia Pacific regions?
I'm sorry, I didn't get you.
Data analytics, which helps in better decision making of the clinicians. What nutrition should be given to a particular patient?
Well, I think that will come. That will invariably has to happen. The use of data analytics, the use of AI in guiding the physician towards better medical care. I would probably not see it in my lifetime. But in the end, I think it will just be a tool to assist the physician. Because we are humans, there is this human touch. I don't think any patient, any human will just interact with an AI for the medical care. I think the last to go in the profession will probably be the doctors. I hope so. We are a center. We are a center that specializes in difficult transplants. And that's perhaps why a lot of patients of India comes to us to do a kidney transplant. So we specialize in old patients who have a kidney transplant. We specialize in diabetics. We specialize in patients with heart disease. We specialize in ABO incompatible transplants. We do transplants for patients who have antibodies against the donor, HLA sensitized transplants. So why do we do it? Well, certainly not for the fun of it, but we do it because patients require it. So my first ABO incompatible transplant, which was done in May 2008, was done because if I don't do it, the patient will not survive. That's why I had to do it. And as we do it, we develop our skills in doing it, and then we refine our ways of doing it, and so we get very good results, we get very good outcomes from doing blood group incompatible transplants. Just answered that question. We are trained in Western medicine. So in Western medicine, in Western style of medicine, everything has to be based on research. Every medicine that we used have to be tried and tested and proven to be safe, effective, and free from major side effects. In other words, the drug shouldn't kill the patient, and it should show that it is of good use to the patient. Alright, you may say, and the Chinese patients tell me that too, Ayurvedic medicine has been used for 5,000 years, Chinese medicine has been used for 5,000 years. Now your own doctors, your own local Indian doctors have published articles showing that Ayurvedic medicine has a high content of lead and mercury, and they are potentially toxic to the person. So sometimes we have to keep an open mind. We have to try something that doesn't at least do harm to the patients. So you have to be careful whether you're going to use Ayurvedic medicine or whether you're going to use Western medicine. But at least in Western medicine, we know the benefits and we also know the risks. Well, perhaps it's not because of increasing numbers of people having kidney failure. It's likely because of increased detection of kidney disease. So, if your country doesn't grow economically, then a lot of patients don't see a doctor. A lot of patients don't live long enough, so you wouldn't know that you have kidney disease. As your country grows in affluence, then more patients are diagnosed with kidney failure. More patients live longer to have kidney failure. And that, of course, gives you the perception that there is an increased incidence of kidney failure, patients who require a transplant. But of course, with affluence, you have affluent diseases. You have obesity, you have diabetes, you have more hypertension, and that, of course, leads to increased risk of kidney failure. So there are two things to this issue: increased diagnosis and perhaps an increased number of patients with risk of developing kidney failure. So how long does a kidney transplant last? Every center is going to be different because every center has a different way of doing their transplant, has a different way of treating the patients. I always tell my patients, putting in a new kidney is not exactly like buying a new car, but it's also similar to buying a new car. When you buy a new car, they give you maybe the first 2 years, warranty. After that, you have to service your car. Unfortunately, in kidney transplantation, there is no warranty for the first 2 years. It needs regular servicing. So if you look after your kidneys carefully, we tell the patients you have a 50% chance that your kidney will last you 15 to 17 years. Unfortunately, at this moment, I tell my patients, no kidney lasts forever. No transplant kidney lasts forever. Well, that is something that confounds nephrologists too. Well, part of it is because of diabetes. Worldwide, the incidence of diabetes is increasing, even in the US. So diabetes is a major cause of kidney disease. Part of it is because of increased diagnosis. So when you talk about, just as I told your colleague just now, in countries like China, India, part of it is because of increased diagnosis, as there is an increasing percent of middle class people in your countries. They are going to see doctors. They are going to get diagnosed with kidney disease. It doesn't mean that there wasn't any kidney disease in the first place. If you don't have the resources, you won't get diagnosed. So part of it is increased detection of kidney disease. This is an international worldwide regulation that was created by at the Declaration of Istanbul more than 10 years ago, together with the WHO. The aim of it is to prevent organ brokers from abusing people and use their organs as organ trading. Now, there is no compromise in organ trading. There is no way that you can take somebody's kidney or use somebody's liver and pay them a nominal sum and then they suffer in future. So there can be no relaxation in the rules regarding organ transplantation. The problem with kidney disease is like the problem with fatty liver. It has no symptoms. So backache, which a lot of people think may be the cause of kidney disease, is usually absent. The most common cause of backache is musculoskeletal, the spine and the muscle. Unless you have kidney disease, backache is very rare. Different doctors are going to think differently. So it's not possible for me to speak for the other doctors. But if you're not happy, then you should go and get your second opinion. I mean, it's your life, it's your kidneys, it's your money. So don't be satisfied. If you don't think your doctor is doing the right thing for you, find another one who does.
When we talk about lifestyle disorders, if you would like to share any experience, any
Lifestyle would be, do not be overweight because it makes your blood pressure very hard to control. Try and lose weight. Sensible, healthy diet. That's the recommended lifestyle.
And which are the countries who are providing the best of the facilities when it comes to kidney transplant
Wow.
or liver transplant? Would you like to, as per any rankings or any studies, research, or maybe out of your experience?
I don't think it's a matter of countries. It's a matter of center experience and the doctors. So if you find the right center and you find the right person who has the experience in doing the transplants, I think that's what matters.
How much awareness do you see globally among the people about when it comes to organ donation?
Well, I think in India there has to be an increased awareness in organ donation. It's growing, it's starting. There is a website, by this lady. She's a donor. Perhaps I could give you her contact and you should talk to her. She is really very aggressive in promoting both deceased and living organ donation because she herself is a donor. She donates. She has donated her kidney to her father. So she's very actively promoting organ donation. I think you all should go and talk to her and help her promote organ donation. That would be very, very helpful to the country. I can give you